Hi everybody, it's Dr. Brighton here. I'm here again with Dr. Scott Glaser. If you saw him during the March Madness pick for our winner who gave a review on Google Reviews. And today he's actually going to help us with the Tip Tuesday. So Dr. Glaser is a radiation oncologist, and he practices in the greater Los Angeles area and was recently ranked one of the top radiation oncologists in the greater Los Angeles area. So he's a ways away from Grand Rapids, but as most of you know, I was actually out here in the Los Angeles, California area for some continuing ed, and so had some time to spend here, fortunately, with Dr. Glaser, and asked him if he wouldn't mind just giving us a little bit of information just about oral health as it ties to treatments for cancer, treatment specifically in the form of radiation. And so without further ado, Dr. Glaser, if you could, give us a little bit.
Thank you, Dr. Mansfield. So, first of all, yes, I live in Los Angeles. It's wonderful here, but I do have strong ties to West Michigan, and that's where I grew close with the Mansfield family, and then a few years ago moved out here. I went to Hope College. My mom grew up in Grand Rapids, and I still have family in the area, so West Michigan holds a special place in my heart, and thank you for having me on. I've also been a patient of Dr. Mansfield's. He's done great work on fixing one of my cavities, so I really appreciate that as well. I'm here to talk to you a little bit about how my field of medicine, radiation oncology, intersects with the dental practice. So there's three main things I want to talk to everyone about today. First of all, early detection. Second of all, preparation for cancer treatment. And third of all, management of long-term side effects of cancer treatment. So first and foremost, a lot of patients who we see in the oncology clinic were actually first diagnosed by their dentist. That's because, when you go to your family doctor for a routine physical, they're not doing too detailed of an exam of the mouth. They may look in there, they may look at the back of your throat, but they're not getting as involved of an exam as your dentist is.
Sure.
So oftentimes it's your dentist who's seeing something that doesn't either look quite right or is a little bit suspicious, and then is referring you on to see someone else who's going to do a biopsy or a more detailed workup. Do you do your own biopsies? I know some dentists do, but
we refer them out to an oral surgeon usually, and have them essentially evaluate it from that standpoint, but we do still coordinate with them. We still receive the information back from the lab, the specimen, and those sorts of things.
So needless to say, the dentist is at the forefront of early detection, which is important in terms of having the best possible outcomes if you were to develop any sort of oral cavity or head and neck type of cancer. So seeing your dentist every 6 months is very important in terms of making sure nothing suspicious or wrong is going on from a cancer perspective, in addition to the normal dental health that Dr. Mansfield does such a good job of providing to his patients. And secondly, when we see cancer patients in our clinic, we tell them to see their dentist prior to initiating treatment, and that's because anytime someone's undergoing radiation treatments, we worry about the effects that it could have on their teeth. So when you're getting radiation treatment for a cancer, say of the throat or the mouth or the tongue or the oropharynx or the nasopharynx or anywhere in the head and neck region, we worry about both the direct and indirect effects to the teeth. First of all, the mouth is supplied by several salivary glands, the largest of which is the parotid, which sits kind of in this region, but also the submandibular glands and the sublingual gland, and all of these glands are involved in making saliva. And when you get radiation treatment to your head and neck region, the long-term effect to those glands is that they dry out, and that results in less saliva in the mouth. And when there's less saliva in the mouth, well, then the body's natural defense mechanism against bad things happening has been kind of knocked down, and then we worry about what's going to happen to your teeth in the long run. So we send our patients to the dentist ahead of time in order to evaluate should anything happen while the mouth is in a healthier state of being before starting treatment, like should a tooth that's close to needing to be pulled, should it get pulled ahead of time in preparation for treatment? And then what types of things should we have in place for once treatment is over, like dental trays for more frequent fluoride treatments or something like that to help the teeth be in the best shape that they can be both during treatment and afterwards. And then monitoring for long-term problems, which are more rare, but things like radionecrosis of the jaw is something that it would often be diagnosed and initially managed by the dental team. So we work very closely with our dentists in terms of getting our patients ready for cancer treatments.
Absolutely. So you can see quite a bit of really unique information there that goes back and forth between the two specialties, and that's why we love Dr. Glaser. So full of all kinds of information, and plus when you come visit him, you get to have this. So we miss all of you. We're excited to see all of you, but thank you once again for tuning in to Tooth Tip Tuesday, and thank you, Dr. Glaser. Appreciate it.
Thanks, Dr. Mansfield.